Well, a new study out from McMaster University has found school closures may not have been necessary to prevent the spread of COVID-19. The two-year review looked at the virus in schools and daycares, finding the settings were not a significant source of transmission of the virus, but only once infection prevention and control measures were in place. The review was published in the Lancet, and it found that masking, vaccinations, and test-to-stay policies were the best method to reduce spread in schools and daycares. And joining us now with more on this study is the lead author, Sarah Neal-Stromko. Sarah, thank you for joining us this morning. This is a very surprising study for many people out there. So, Sarah, I'd love to first start off by getting your initial reaction to the findings. Were they surprising to you?
So this is actually the culmination of about a 3-year project where we continuously looked to the emerging scientific evidence around the world on the impact of schools and daycares in COVID-19 transmission, and also the impact of different infection prevention and control measures that were in place. So we actually started this work back in April and May of 2020. And public health decision makers had really important questions about how to safely reopen and operate schools and daycares. And at that point, we were really relying on information from other infectious diseases and studies that had looked at transmission in schools before the stay-at-home orders had been put in place. But as time evolved, we were able to integrate more data from other countries that reopened before us, like Australia, who is on a different school schedule, and be able to update the evidence to make more informed decisions. So as time went on, our findings and our understanding changed as variants of concern became more prevalent, as vaccinations came into play. So really what this speaks to is the importance of research and science and understanding what's going on in different schools and daycare settings as the pandemic evolved, and also support for what we call evidence synthesis teams, like ours at McMaster, and there's others across the country, and being able to find and interpret the new studies that are coming out from around the world, appraising those so that we know which are the highest quality and most trustworthy, and then bringing those together to present an overall picture of what we know rather than just relying on a single study. So our understanding really evolved over time.
Well, let's talk a little bit more about those findings, Sarah. It shows that it's only effective to not have schools closed down if all three policies were in place, which was masking, vaccination, and regular testing. I want to ask you, how effective was that in Ontario? How many facilities did we see actually using all three of those measures?
So what we saw, we were able to look at sort of two categories of studies. The first, comparing jurisdictions that stayed open versus those that shut down in later waves of the pandemic. So this was not in the initial first stay-at-home order wave. And we were able to look at what happened in the community as a whole when those schools opened or closed, or looking at sort of changes over time as that happened. And we basically what we found was that when basic measures were in place, the patterns of transmission we saw in schools really reflected the patterns that were happening in the community. In some studies that looked at where cases originated from that were detected in the school setting, most often those cases originated from outside of the school. And so there wasn't this sort of mass spreading within the schools that we were really concerned about. A separate group of studies that we looked at were which of the measures seemed to be most important within the school settings. And not surprisingly, vaccination was one of them. Masking was also one. And then test-to-stay policies. So that basically means that students who had been exposed to a case in the classroom were required to test negative before they came back to school. And so that was really effective because there were concerns that by not having the whole class go into a mandatory quarantine, there may be more spread than we would have seen otherwise. But those test-to-stay policies were actually very helpful, and in particular because they allowed students to stay in school for longer.
Okay, Sarah, my last question for you here. Judging off of this study, it seems like schools didn't have to close. Is that what you're saying? Is that what this study is saying?
What we're saying, so that initial closure, those initial stay-at-home orders that were put in place, I think really made a lot of good sense because of the information we had at the time, which was not a lot. So, but in subsequent waves later on as the pandemic evolved, particularly after vaccinations were more common, at that point it seemed that school closures didn't make as much of a difference as we thought that they would.
Okay, that's lead author Sarah Neal-Stromko. Thank you for joining us today and sharing your insights with our viewers.
Thank you.